In today's video, we are talking about what the youth should know about STIs and safe sex. So STIs are infections that are passed from one individual to the other through sexual contact, including the oral route, the vaginal route, and the anal route. There are so many causative agents of STIs.
Some of the causative agents of the STIs will be the bacteria, will be the fungi, will be the parasite, will be the viral. So what are some of the fungi? And what is the fungi will cause the Candida albicans, which are most our ladies or in our local settings we say when you're white and when you're odepua. And the bacteria ones they will cause the bacteria vaginosis, which in our local settings the ladies will come and tell you a bouncer fish. So you see these vibes, they will come and be telling you all these things. And with the viral ones too, the most common ones we know is the HIV, which will lead to the AIDS. And other ones will be the HPV and the HSV, which is the herpes simplex virus and the human papilloma virus.
Parasites, we have the trichomoniasis that is being caused by the Trichomonas vaginosis parasite. So what are the causes of these STIs? So STIs are being obtained through sexual contact. Some of these pregnant women too do not take their STI status well. So in times of pregnancy, they may contract these STIs, and if care is not taken, may be passed to their baby, which is known as the vertical transmission. So vertical transmission is the transfer of infections from the pregnant mother to its offspring during the stages of pregnancy, delivery, and even childbirth. So we also have other causes of this STI, that is the blood transfusion. Some of these bloods are not screened well at the hospitals. So in the case where somebody needs blood, and this blood that is about being given to this individual is contaminated, they end up passing their same infection to the patient. We also have the skin to skin contact. So this virus HPV can be passed on from one individual to the other, even just through skin contact, even without penetration during sex. So what are the things that you see for you to know that yes, I have STI?
So the myth about people is that you can look into people's eye and tell them they have STI, and that is a myth. Looking into somebody's eye to tell the condition is a myth, because some conditions don't present themselves early. And with the STI we are talking about, you're going to have this asymptomatic and the symptomatic. So you can't just look at the person's face and have it, because the asymptomatic person will have the symptoms being hidden and later present itself. So at the time you are looking into the person's face, you don't know the person might be at the asymptomatic phase. What are the symptoms of the person when somebody is having any of these above mentioned conditions? The person might be complaining of pain, which is during urination, burning sensation. The person will having fever, which is feverish. The chills will be there. So these are some of the complaints they will be telling you, whether you are the partner or you are the colleague. Then these are the symptoms the person will come. The most common ones the person will present. As the person grows in this particular condition, remember the person will be telling you intermenstrual bleeding for our ladies, postmenstrual bleeding for our ladies. So during their menstruation, they will be having the heavy menstrual blood flow, and then after their menstrual period, still they'll be seeing the blood flow and even change in color and the flow. Then they'll be having the postcoital bleeding, having sex with their partners, and after the sex, they are having bleeding coming out there. And in there, sometimes too, even without the sex, they are having the normal bleeding.
So in some cases too, they have sores and blisters all around their genital areas. Sometimes too, they occur in the mouth, and sometimes too, with herpes too, you find these blisters all around your skin and around your neck. And also it presents with swollen lymph nodes around the groin and even under the chin. So how do we go about these STIs? In what way can we prevent all these STIs that are being mentioned of? All
So preventing the STI is preventable, it's treatable. We can manage the STI if detected early and not gotten to a point where your physicians will be telling you it's too late. So when we got in contact with the STIs, well, how can we prevent them? We can prevent them by using protected sex, or when we undergo protected sex by using the condom. The condom is the safest, or let me say, it's one of the safest means we can protect ourselves from getting this particular condition. But hey, the abstinence is the best. But my guys, my ladies will not agree with me, because they want to enjoy the thing raw. They want to enjoy themselves. And you can't prevent them, because the sex is there for them to enjoy themselves. So, but the abstinence is the safest of all, not to prevent that. But hey, somebody will also tell you, I'm married and I'm having this infection. What about abstinence? What am I using abstinence for? I can't use the abstinence for anything because I'm married. Yes, you are married, and that is why you can use the protected sex as well. And then somebody in your youthful age, you're not married, you are single, you can still protect yourself. If you still want to have the sex, use the condom, protect yourself, and you'll be free. My guy is going to the barbering shop, my lady is going to dress their hair. Make sure the sterilizer with the sharp objects you are using, they are well sterilized so that you get your fine haircut and not get in contact with any infection. You come back home safely and you are fine.
There are so many clinics too around us offering free screening for STIs. So it's advisable that each and everybody goes to these clinics and get tested to know their STI status, especially for people practicing multiple sex partners and people entering fresh relationships. And also, it's advisable to also go to these clinics and get vaccinated to manage some of these infections, such as HIV, the herpes, and the HPV virus, and hepatitis B as well. It's also advisable that you avoid sharing your dildos and vibrators. You can also put condoms on these vibrators each and every time you are about practicing or having sex.
So we are preventing ourselves. And one of the prevention I also tell you is to boost your immune system very well. Boosting your immune system will also help you prevent these infections. We don't wait to get these infections before we get treated. We can also prevent it by drinking in our supplements or taking our supplement, doing our workout, eating very well, drinking our fluids. Hey, well, you know what is happening in our society now. The gala has destroyed our water bodies, has destroys our food stars, and that is why we have the supplements on the system now, the supplements on the market, the Hepa Plus, the Pavi, and the Plasmos. Take them, it will prevent you, boost your immune system, help you prevent these conditions. Is it the bacterial vaginosis? Is it the candida? Is it the gono? Is it the syphilis? Is it the HI? Before you can get in touch with this condition, boost your immune system and prevent them before even getting them. The Hepa Plus, the Pavi, and the Plasmos will help you. A natural supplement which is good for you, you can prevent it.
So we are about ending this podcast, and I'll advise that each and every time you're having sex, you put on condoms, you get vaccinated, you go to your clinics and get tested to know your STI status. And hey, if you want to boost your immune system, it's Hepa Plus, Pavi, and Plasmos.